Our programs offer many languages. Please visit suprememastertv.com/schedule.
In coordination with qualified psychotherapists, music can really be used to kind of provide a safe container for exploring psychological issues. When we think about music that makes you cry, sometimes we can kind of have emotions that are really pent up.
Music therapist Eva Hammer, Vegan, The Compelling Health Benefits of Music Therapy, Part 1 of 2. Continue watching to find out more.
Animal people eating religious leaders will be punished heavier cause you know the right but you do the wrong.
Hello translates as hello in Seychellois Creole. That's how the friendly Seychelles people may greet you if you ever visit one of their numerous islands. Angelic viewers, my name is Angie. The kind Seychellois thank you for being a shining example of generosity and compassion who guides others toward a brighter world. Welcome to our show, Music Therapist Eva Hammer, Vegan, The Compelling Health Benefits of Music Therapy, Part 1 of 2. Today, we are privileged to invite vegan American music therapist Miss Eva Hammer to introduce music therapy. Miss Hammer received her Bachelor's of Music in Music Therapy from Western Michigan University in the United States and became a certified music therapist after the completion of her internship at a hospice. She previously worked for Journey Care, a provider of palliative, supportive, and end-of-life care for patients of all ages in Illinois. With many years of experience in music-related treatment, Ms. Hammer sees great potential in music to enrich people's lives and provide comfort. Currently, she extends her compassion to the people of the animal kingdom by being part of the Animal People Rights Movement as legal coordinator for Direct Action Everywhere, a Shining World Courage Compassion recipient. To many people, music is a way of expressing themselves. It allows us to communicate without any cultural or linguistic barriers. In addition to being an outlet for artistic creation, what music can bring to our lives is much more than we might think.
Music can be used for wellness as well as to treat illnesses and disorders, and music therapists can work on enhancing wellness in addition to treating disorders. There's extensive research in a lot of different fields of music therapy, so the strongest research that I've seen has been in the NICU, the Neonatal Intensive Care Unit. We've seen programs that get babies who are born too early to start feeding when they're having a difficult time absorbing nutrients because they maybe don't have the suckling response really honed yet, or they're having a difficult time reacting to all the stimulation in their new environment after they were born. And we find that babies can go home on average a week earlier with music therapy than without, which saves lives and also saves hospitals really a lot of money. Music therapy's origins happen around the 1940s. We think of volunteers who were singing to war veterans in hospitals for pain reduction. From there, slowly different associations formed, and board certification has been around for several decades the way that it exists now. So now if someone says that they're a music therapist, we know exactly what they mean, that they've been through this board certification process, which includes a 4-year university, a 6-month internship, and a board certification exam. Music therapy is the individualized use of music therapy interventions to achieve therapeutic goals by a credentialed professional. It's kind of a mouthful. In a nutshell, I say that music therapy is a set of ways to use music to achieve non-musical goals. So we think of the kinds of things that a music teacher would work on they're going to be looking at musical goals, trying to make somebody a better musician. Music therapists look at other types of goals. So those might be physical, emotional, or even spiritual.
During the course of treatment, many practices can be employed to suit the needs of individuals, including listening or dancing to music, singing, playing instruments, or discussing music.
Music therapy in hospice is very, very useful, and it can be useful for all sorts of reasons. It can be useful for improving the quality of life for people with dementia. Often people with dementia don't really know what they're going through, or at least it doesn't seem that way, but music therapy can really improve their quality of life. I think basically anyone can benefit from music therapy or from music wellness programs. It's particularly beneficial to babies and mothers in the NICU, for people in hospice, for kids in special education programs, for people with physical disabilities, for people with brain damage, for people with emotional disabilities or emotional disturbances. I think that music therapy is applied to a very broad range of people, and I would encourage music therapy to be tried in conjunction with other therapies wherever recommended. In coordination with qualified psychotherapists, music can really be used to kind of provide a safe container for exploring psychological issues. When we think about music that makes you cry, sometimes we can kind of have emotions that are really pent up, and having a music experience in a really safe environment, something like songwriting or analyzing the lyrics of a particularly powerful song, we can sort of open up that container and allow us to process some of those harder emotions. And so when there's a professional in the room who's really able to help a client work through some of those really difficult emotional processes, then that's when music therapy can really help with things like trauma or anxiety or some of these really deep-seated emotional problems.
Maybe that's why some people instinctively choose to listen to more calming music when they are in sorrow.
Vegan tested negative for cruelty.
We will pause a moment to enjoy some soothing music and we'll be right back. Please stay tuned to Supreme Master Television.
My friend, you will not walk alone.
Welcome back to music therapist Eva Heimer, Vegan, the compelling health benefits of music therapy, part 1 of 2 on Supreme Master Television. Let's continue to learn more about other ways that music therapy can help us. Music can act as a means to examine, realize, and dig out deep emotions. Do people get to choose their favorite genre of music during therapy?
Often religious music is used in hospice. Music that's particularly important to a person in their faith can kind of bring up a feeling of sacredness and a safety to be able to really examine some of these things that we need to deal with while we're coming towards the end of our lives. It really depends on the intervention, but when I was working in hospice, I always wanted to know what someone's preferred music was, because preferred music is always going to be better when we're talking about something like lifting moods and things that involve pain management, because whatever makes you feel the best is going to be obviously the best music for you.
When we are absorbed into the melody of music, it seems as if we are enclosed in a sphere where we can temporarily forget all the stress. Sometimes, it even lessens our pain mentally and physically.
We definitely see the release of some of those pleasure hormones. You think of dopamine and serotonin when hearing pleasurable music or music that's preferred. And that can certainly be used in music therapy to improve mood or make certain activities more tolerable if we're thinking of exercise or schoolwork for children. And music, for so many people, is a really important coping mechanism for stress and a really important way to deal with it and to lower stress in their body, even in spite of external stressors in their lives. Lowered stress is related to all sorts of wellness outcomes. So we expect people with lower stress to even live longer, to sleep better, to have lower instances of obesity. lowered stress and measures of lowered cortisol is related to really unlimited wellness outcomes in the body.
In addition to relieving stress, music therapy can also help people with chronic obstructive pulmonary disease or COPD, which is chronic inflammation in the lungs that causes air to pass through less smoothly.
We certainly see a lot of people with COPD and other respiratory problems in hospice work. We'll see very shallow breaths from people who are in a lot of pain. What a music therapist will often do in that context is kind of sync up with the rhythm of the breathing. And when the music and the breathing, the biological rhythm are synced up, the music therapist has the ability to actually slow down that music and thus slow down the biological rhythm that we've synced up to and actually make the breathing slower and longer in a way that really relaxes patients and reduces pain and respiratory distress.
Many thanks to Eva Heimer for introducing to us to the concept of music therapy and how it works to lessen stress and discomfort. Please join us again on Saturday, December 25th for music therapist Eva Heimer Vegan, The Compelling Health Benefits of Music Therapy, Part 2 of 2, where we will learn more about how music therapy works inside the brain. For more information about Eva Heimer, please visit facebook.com/eva.c.heimer, twitter.com/Eva Heimer.
Rescue, my friend.
And so, anytime that you try to consume another living thing, I think that you are taking away from your essence. The respected Spirit Wolf vegetarian.
Brilliant viewers, we are honored to have you with us today for our program. Up next is When Honesty is Lost, Signs of the Last Hour from the Hadith, Part 15 of 16 on Between Master and Disciples. May you enjoy bliss and tranquility always.
Our programs offer many languages. Please visit suprememastertv.com/schedule and suprememastertv.com/HL.
Nos programmes offrent plusieurs langues. Veuillez visiter suprememastertv.com/schedule y suprememastertv.com/HL.
Nuestros programas ofrecen varios idiomas. Visiten suprememastertv.com/schedule y suprememastertv.com/HL.
ਸਾਡੇ ਪ੍ਰੋਗਰਾਮ ਪੇਸ਼ ਕਰਦੇ ਹਨ ਅਨੇਕ ਭਾਸ਼ਾਵਾਂ। ਕਿਰਪਾ ਦੇਖੋ suprememastertv.com/schedule ਅਤੇ suprememastertv.com/HL